October is Breast Cancer Awareness Month, a global campaign dedicated to raising awareness about breast cancer and promoting early detection and treatment. Organizations like the National Breast Cancer Foundation and Susan G. Komen provide valuable resources, support, and education to those affected by breast cancer. Early detection through regular screenings, such as mammograms, can significantly improve outcomes. It's also important to be aware of the risk factors and to know what is normal for your body. There are several risk factors for breast cancer, some of which you can control and others you can't. Here's a breakdown. Risk factors you can't change: age. The risk increases as you get older, especially after age 50. Genetic mutations. Inherited changes in genes like BRCA1 and BRCA2 can significantly raise your risk. Reproductive history. Early menstruation before age 12 and late menopause after age 55 expose you to hormones longer, increasing your risk. Family history. Having close relatives with breast cancer can increase your risk. Personal history. If you've had breast cancer before, you're more likely to get it again. Dense breasts. Dense breast tissue can make it harder to detect tumors and is associated with a higher risk. Previous radiation therapy. Radiation treatments to the chest before age 30 can increase your risk later in life. Risk factors you can change: physical activity. Being physically active can help lower your risk. Weight. Being overweight or obese, especially after menopause, can increase your risk. Alcohol consumption. Drinking alcohol increases your risk. Hormone replacement therapy. Some forms of hormone replacement therapy, HRT, taken during menopause can increase your risk. Other factors: exposure to DS. Women who took the drug diethylstilbestrol, DES, during pregnancy have a higher risk, as do their daughters. Genetic testing for breast cancer can help identify inherited gene mutations that increase the risk of developing the disease. Here's a breakdown of what you need to know. Key genes involve BRCA1 and BRCA2. Mutations in these genes are the most well-known and significantly increase the risk of breast and ovarian cancer. Other genes. Mutations in genes like PLB2, CHEK2 ATM, CDH1 PTN, and TP53 can also increase breast cancer risk, though they are less common. Who should consider genetic testing? Family history. If you have close relatives with breast cancer, especially if they were diagnosed at a young age or have had multiple types of cancer. Personal history. If you've had breast cancer, especially at a young age or have had multiple cancers. Ethnic background. Certain ethnic groups, like Ashkenazi Jews, have a higher prevalence of BRCA mutations. How is genetic testing done? Sample collection. Genetic testing can be done using a blood sample, saliva sample, or a cheek swab. Laboratory analysis. The DNA from the sample is analyzed in a lab to look for specific mutations. Benefits and considerations: risk assessment. Knowing your genetic risk can help you and your healthcare provider make informed decisions about screening and prevention. Family planning. It can also provide valuable information for family members who may be at risk. Emotional impact. It's important to consider the emotional and psychological impact of the results. Genetic counseling is recommended to help navigate these aspects.